Hello everyone, and thank you for joining us today for this 10th educational webinar organized by Oncia community on integrative oncology. So we are truly delighted to welcome Dr. Gabriel Lopez, leading voice in integrative oncology. He's the medical director of the Integrative Medicine Centers at MD Anderson Cancer Centers, and is also a member of the executive committee of the Society for Integrative Oncology. So good morning, Gabriel, and thank you for being here with us today.
Good morning.
So let me introduce myself. I'm Françoise Vamek. I will be your host today. I'm the founder of Oncia Community. Oncia Community is committed to support people affected by cancers by raising awareness of the positive impacts on health, on integrative oncology, and also in accelerating integrative cancer, creation of new integrative cancer centers across the world. So what I can say is last October, I was at MD Anderson Cancer Centers, welcomed by Dr. Lopez, and I was really impressed by the integrative cancer center. So it's an entire floor with stunning views to Houston City, with windows in every room. But what was really impressive is how they integrate integrative oncology with conventional therapy, how they work hand in hand with oncologists in order to reduce side effects of patients and improving quality of life. So today, Dr. Lopez will share with us the key principles of integrating integrative oncology into clinical practice and how you can apply these approaches in your own practice. So following the presentation, we will have an extended live Q&A session where Dr. Lopez will answer your questions directly. But before we get started, here are some practical details. So the webinar will last approximately 1 hour. It will be recorded, and the replay will be available on our website. And if you have any questions, please use the Q&A button at the top, at the bottom. The chat is disabled. So if you have any questions, please use this Q&A button. So, and after the presentation, we will take time to allow Dr. Lopez to reply to your questions. And so I will now hand over the floor to Dr. Lopez. And thank you again for being with us today.
So thank you. So welcome to everyone joining us. I'm honored to be able to present to you all today, and we'll share with you about integrative oncology. I'll introduce 2 different cases, practical applications of what integrative oncology can look like in clinical practice, and then we'll definitely leave some time for question and answer. So as far as the objectives, I'll give an introduction to different definitions that are fundamental and very important to be able to understand, that these terms of integrative medicine, integrative oncology, complementary alternative medicine are not interchangeable, and how important that is in our conversations with other health professionals, as well as in conversations with our patients to help them understand what the distinctions are between these different kinds of medical practice that do exist. A lot of times, patients will encounter different kinds of terms, the alternative medicine, integrative medicine, and complementary medicine. Sometimes those terms aren't used, but they are referenced in different ways across literature, whether it's magazines, published books, supplements that they may encounter. And it can be difficult for patients as well as health professionals to know, what are sources of information that are reliable, evidence-based. And I in my own clinical practice often will have patients share about what they've been reading. And for me, that is very important to understand so that I have a better idea about what framework they are thinking about when talking about integrative medicine. And so the framework that a patient comes to a consultation with might be different than what we actually use in clinical practice. And so those differences are important to be aware of and to use as part of building that trust in that conversation. So I share these results. So I was reading the question. So one was alternative therapies are a good supplement to standard cancer treatments. 73% of the individuals surveyed said that they agreed with that statement. The concerning response was to the following question: cancer can be cured solely through alternative therapies without standard cancer treatments. So 35% of individuals agreed with that statement. And if you look at the bar graphs below, so I was mentioning that there's the bar graph at the bottom corner, where it shows that younger people are more likely to hold the view that cancer can be cured through alternative therapy. So in that age group between 18 to 37, nearly half of the population of those interviewed agreed with the statement that cancer can be cured through alternative therapies. And so I'll, say that that is concerning, because the idea is that we don't want integrative medicine to be seen as something that is a replacement for conventional cancer treatment. It's something that can be used thoughtfully alongside cancer treatment. And this is why it's important to think about definitions of alternative, different from integrative, different from complementary. So if we look at some of the definitions that are in use, the National Center for Complementary and Integrative Health uses the following terms. So if a non-mainstream practice is used together with conventional medicine, it's considered complementary. If a non-mainstream practice is used in place of conventional medicine, it's considered alternative. There are other terms that can be in use: functional medicine, which can be a combination of integrative health or naturopathy, and it's not as yet well defined. If we think about the complementary health approaches, according to the National Center for Complementary and Integrative Health, the main categories are natural products, mind-body practices, and other complementary health approaches. And what's important to recognize is that the level of evidence is not equal across all of these different practices that would be considered complementary health approaches. And that's what's important to know when navigating integrative medicine in clinical practice, is that, although there are a lot of different practices, interventions that can be part of integrative medicine, there are different ways to use them, and there's different levels of evidence supporting them. And it's important to take that into account when making clinical decisions about what's appropriate, what's safe for one patient versus another. So, and again, thinking more about definitions, so putting integrative medicine alongside the other terms. Alternative medicine is used in place of conventional medicine. Complementary medicine is used together with conventional medicine, and integrative medicine is used together with conventional medicine in a deliberate manner that is personalized, evidence-based, and safe. And so as an example, acupuncture is quite often thought about, considered an integrative therapy. If someone were to use acupuncture with the intent of curing their cancer, that would be an alternative use of acupuncture. If they want to do acupuncture together with their cancer treatment, but not really thinking about how it can help, but just because it might help, could be nice, I heard it's good, that would be complementary. So it's just done, not neither safer nor beneficial in terms of how it's being applied. But integrative medicine would be saying, oh, you're having nausea or you're having joint pain in connection to the cancer or its treatment. There's evidence of the use of acupuncture for the relief of nausea and joint pain. So that would be an integrative, evidence-based use of the same practice that can also be considered complementary or alternative, all depending on how it's used. And so when patients have questions about the use of different kinds of interventions that don't fall within the evidence-based realm, one thing that's important for health professionals is to respect patients and not to immediately dismiss things that might not be perceived as evidence-based. Right? So we have these definitions of integrative, alternative, and complementary in mind, but the important thing is not to tell the patient, oh, that's alternative or that's not true, don't do that, because that's not going to help establish trust. And so important to listen, and listening and it shows that you're interested. Listening helps to continue that bridge of communication that's important, not only at that time, but in future parts of their cancer treatment journey. We know that individuals, as the cancer treatment progresses, especially if there's advanced disease, that there's increased use of integrative, or I would say complementary approaches throughout, and there's more likely a pursuit of alternative therapies as the cancer progresses. And the other important thing is that we don't know everything as health professionals, and it is important that if a patient asks or comments about a therapy that we don't know about that can fall in that space of alternative treatment, that it's okay for us to acknowledge that, to say, I don't know, we don't know, that's very interesting, I want to learn more about it. So it's important to engage in a conversation with the patient rather than try to protect ourselves or our lack of knowledge in that one space by dismissing it. And if there's ever any concerns about kind of the conversation that might be beyond the scope of what you feel comfortable with, that's where integrative medicine programs can be quite helpful as a place to refer patients for further conversation. So if we think about the term integrative medicine as it's applied in the context of specifically oncology care, there is a definition that's been widely accepted. This was published in the Journal of the National Cancer Institute, and I'll go ahead and read this. So the integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and/or lifestyle modification from different traditions alongside conventional cancer treatments. It aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, empowering people to prevent cancer and become active participants before, during, and beyond cancer treatment. When we surveyed patients at MD Anderson regarding their interest in use of integrative therapies, I wanted to share the results of the survey because in that area that's in the red rectangle, you can see in the second column the number 88%. So 88% of patients surveyed in our outpatient clinics said that they were combining complementary alternative medicines together with their conventional cancer treatments. However, only 61.8% specifically stated that they were actually having conversations with their medical team about their use of complementary alternative medicine. So here we learn really that the majority of patients are using these, and it's important that we ask patients about their use and have open conversations so that we can explore themes, especially, for example, if there are any concerns about herb-drug interactions that may affect cancer treatment efficacy. So what does clinical practice look like? And I'll say that that survey that I just shared was really important in driving the awareness of a need for creating a space where patients can have conversations with professionals that have additional kind of expertise and training in integrative medicine to address that complementary health approach use. And so the idea was to create a clinical center based on what other clinical practices look like so that it doesn't feel alternative, that it's just like any other clinical center where you get the patient's history, evaluate them, and understand why, what symptoms they're having, what their goals are, and see how best integrative therapies can be a part of that conventional cancer treatment. So we used the biopsychosocial model. This was first described by George Engel, published in the journal Science all the way back in 1977. The biopsychosocial approach includes mind-body practices, physical health approaches, social approaches. The idea is that the person is much beyond just a biological organism, and that in order to help heal someone in terms of their disease, it's also important to understand the circumstances around their health, and that includes how they're doing physically, how they're doing mentally, how they're doing socially, and these are all things that we need to be aware of when making decisions about their healthcare journey. In our center, our approach is first to have patients referred to integrative medicine from any one of the areas within the hospital. So any oncology service in the hospital can refer a patient to integrative oncology for a consultation. And the first consultation that always happens in our center is a consultation with one of our physicians. The physicians will evaluate the patient, and at that time is when we develop what we refer to as the integrative care plan, where we work on coordinating care and making decisions about next steps regarding what interventions are going to be most appropriate for that patient. Our interdisciplinary team includes massage, acupuncture, music therapy, yoga therapy. We have a dietitian on our team, a physical therapist that does exercise counseling. We have health psychologists, advanced practice providers, nursing, and also physicians from different backgrounds, including medical oncology, internal medicine, and surgical oncology. One of the key elements of how we evaluate patients is we do ask them, we get their medical history, but we also use patient-reported outcomes. So we have patients complete assessments where we ask them, for example, in this patient-reported outcome, that might call, we ask them what are their top 2 goals for their integrative medicine consultation on that day. We also use tools like the Edmonton Symptom Assessment Scale, so finding out about the patient's symptoms within the prior 24 hours to the consultation, and then also use the Promise Health Scale, which gives us an idea about both the physical and then the mental health aspects of the individual. And so we use this as a way to already have patients start to think about what symptoms they're having and help us to target symptom control. As an example, if you look at the ESAS FS, so this is the ESAS version that has the financial spiritual components to it. One of the symptoms in that graph says hot flashes 10. So if we see someone with a hot flash 10, which means 10 out of 10, so worst possible hot flashes within the last 24 hours, that would indicate to us that that would be perhaps one area that we can start a conversation with that patient to help address and, for example, consider potential relief with a treatment like acupuncture. We also do pre-post interventions. So when patients do go for treatments like massage or acupuncture, patients complete the assessments, the patient-reported outcome assessments, the ESAS specifically before and after the intervention. And this helps us to be able to know how they're responding in one session, but also helps us to track over time any changes in symptoms. We also use this pre-post intervention data for clinical research. Some of the things that we found out in terms of looking at the data from the patients that have come for consultations in our center, if you look at the table 1 on the left hand column, the majority of patients that we see, so almost 70% are women, 30% of diagnoses breast cancer, followed by gastrointestinal malignancies, and about a third have metastatic disease. And then when we look at the top 3 reasons that the majority of patients state that they are interested in having their consultation with us for integrative holistic approach, herb supplements, and nutrition are the top 3 areas of interest, followed by others like pain, anxiety, fatigue, sleep, neuropathy, and hot flashes. So how do we organize the plan? One of the things that we thought about early on is that, a lot of times we think about medication prescriptions. And so we thought that the integrative medicine care plan should also be thought of in a prescriptive way. And then in order for patients to understand the interrelated nature of the different symptoms and health goals, that this graph would be a useful tool in helping with conversations and also help with the clinical decision-making part of interacting with our patients. So diet, exercise, stress, mood, sleep, and symptoms. These are the 5 circles that we use when having that discussion with patients about their integrative care plan. So as an example of a first kind of patient that would present to us, this first case, we have a 43-year-old woman. She is obese, has a body mass index of 35. She's premenopausal, was diagnosed with early stage breast cancer. She's already finished her treatment and survivorship. She had surgery, she had radiation, has started on tamoxifen. She's not eating well. And she says that when she's stressed, she stress eats. She lives to eat, not eat to live. Her doctor said that she should exercise. However, she's never really exercised before and she's feeling tired. And so she's not sure how she's going to accomplish that goal. She also said that she'd heard about yoga and tried it somewhat in the past, but she's not sure if it's safe or even appropriate for her to consider or continue. She has stress and fear about the risk of recurrence. She has 2 young children at home. Friends and family have recommended a number of supplements that she should take to stay healthy. However, she's not sure which one she should take. One that was recommended, as I have here, is Essiac. And then she also shares having found out that her vitamin D is low and is wondering what to do about that. And then also in connection to her tamoxifen, she started to have hot flashes. And although she heard that there's a medication that she can take to help with hot flashes, she doesn't feel like she wants to take another medication at this time and is wondering if there are approaches that might be integrative to help. So if I categorize the different areas of concern that the patient expressed using that 5 circles model and diet, we have a patient that's obese. She reports stress eating. She's pre-diabetic with a hemoglobin A1C of 5.9. No regular exercise. She shares having anxiety about recurrence. Again, stated that she has 2 young children and she has a worry about her cancer coming back. And then some of the symptoms that she's struggling with, fatigue, the fatigue perhaps limiting her ability to have motivation, energy to exercise, and also hot flashes that she's struggling with. So now we have the patient, we have those different symptoms. We looked at that integrative care plan graph. And so how do we make decisions about what are the best next steps for that patient? And this is where I would say that it is important to think about all the different kinds of integrative therapies that can help, but not to recommend all of them all at once, right? So if we recommend everything, that can overwhelm a patient, or if we even leave the decision making to the patients to be in somewhat of a kind of buffet model where you just kind of lay out and say, these are all the different things that you can do. You choose what you want to do. That can also not be necessarily a successful practice. So it's very important to be thoughtful about what the recommendations are, help the patient understand why the recommendations are being made, that there's evidence supporting or not supporting. There might be more evidence or less evidence supporting one of the recommendations, but helping them understand that you're making these recommendations not because they're your favorite, not because you like them, but because there's evidence behind it. So here you have a graph that we published in Nature Reviews that shows how a number of the integrative interventions, acupuncture, massage, yoga, meditation, tai chi, qigong, hypnosis, music therapy, nutrition, exercise can actually have meaningful impacts on a number of symptoms. If you look at yoga meditation, you can see that there can be benefits across multiple symptoms: pain, arthralgia, fatigue, anxiety, sleep dysfunction, nausea, cognitive dysfunction, hot flashes. And so sometimes, one therapy can, help with multiple areas, and then you can combine, for example, for our patient that we just discussed, perhaps a combination of acupuncture to help with her hot flashes, maybe some combination of yoga to help with some of her stress and anxiety, but also could help potentially with her hot flash symptoms at the same time. So these overlapping benefits of the integrative therapies are important to consider, and graphs like this can be helpful in making those decisions. If we look at the National Comprehensive Cancer Network guidelines, these guidelines are mostly in active use when it comes to making decisions about cancer therapies, but there's also supportive interventions that are included in these National Comprehensive Cancer Network guidelines and include, for example, management of a common symptom like cancer-related fatigue. In the most recent version, so this is the January 2026 update, if you look at category 1, so highest level recommendations, based on highest level of evidence, you can see that category 1 recommendations for patients on active treatment are for fatigue, are physical activity. You also have yoga, have massage therapy, and then psychosocial interventions like cognitive behavioral therapy and psychoeducational therapies. So integrative therapies are already included in a number of guidelines as category 1 recommendations. And so it's important to be aware of the different kinds of guidelines out there that have recommendations specifically for integrative therapies, and you can use these for clinical decision to aid with clinical decision making. Additional guidelines that have been published: the Society for Integrative Oncology, together with the American Society for Clinical Oncology, over the last several years, has published joint guidelines to help with a number of cancer-related symptoms. Here I show one of the examples, an infographic about anxiety and depression and how integrative medicine can help with those symptoms. There are also similar guidelines that have been developed also for pain, also for fatigue. One is coming up for sleep as well. So you can see here that for anxiety, both during treatment and post-treatment, you can see yoga included. And then for depression, during active treatment and post-treatment, you can also see yoga included in these guidelines. And now the challenge I'm going to state here is that although yoga, as I showed in the prior graphic and in here, might be in a number of guidelines to help with fatigue, and now we see anxiety and depression, it's not just any yoga that can help. So we have to also be careful making clinical recommendations that we refer patients to the right yoga therapist that has the right kind of training to help adapt safely that practice, depending on where that patient is, whether they're early on in their diagnosis, post-treatment, post-surgery, or an advanced disease. Want to make sure that they're being safe and appropriately integrating these kinds of therapies into their health. Here is another visualization of how to integrate different aspects of integrative oncology into clinical care. This was published in the Journal of Oncology Practice. So thinking about what happens in that integrative oncology consultation with regards to addressing areas of lifestyle or supplement consultations and integrative medicine for symptom control. I in particular like the way that this table was outlined, where for any symptom, you want to look at how what integrative therapies exist to help with those different symptoms and what references are actually supporting the benefit of that specific kind of therapy to help with that symptom. So this kind of thought process can be very helpful in clinical decision making, but I also would argue that this kind of conceptual, framework can also help us understand when establishing an integrative medicine program, what things are important to include. So what are some essential aspects of integrative therapies that are important to include, whether physically within the center or also connecting with community providers that can provide that expertise and that you can connect with to support patients across a number of health goals. Coming back to the NCCN, the National Comprehensive Cancer Network guidelines, I wanted to show this specific supplement use and survivorship recommendation, which specifically states that integrative medicine or clinical pharmacy should be consulted when patients have questions about supplements. And so, there's not many places where integrative medicine is specifically mentioned, but it's in many different parts, kind of buried into these algorithms and guidelines. And so it's important to recognize that there are specific references to how integrative medicine should be a part of conventional cancer care and support patients with complex questions, and in this case specifically regarding supplement use. And so thinking about supplement use, I just wanted to briefly touch on that. I had showed earlier when we explored what were the number 1, 2, and 3 areas that patients wanted to have addressed as part of their integrative oncology consultation. Integrative approach, holistic approach, herb supplements, and then diet nutrition. And so, when patients are coming with questions about supplements, some of them might be asking about supplements that they already are taking. Some of them may be asking about questions about supplements that they have considered taking. And some of them may have been told by their oncology team to stop taking the supplements and not to start them again until they have a conversation with the integrative oncology doctor. And so I see that quite often, that patients will have their supplements on pause until they come to see us. And then the decision making about what to resume or what not to resume is part of the conversation. So in some of the education points that we address with patients are how to understand labels and understand what different ingredients might be as part of the supplement, understand that just because there's a statement on the supplement that says that the supplement can do something, that's not necessarily what it actually can do. And then also I show here an example where there was one patient who had this list. This is a morning list of supplements. It had a similar list for afternoon and evening. And so, sometimes the consultation may be about, exploring with patients, 5, 10, 30, 50, 100 different supplements that they either are taking or want to take, but that those conversations are important to help establish trust and also to help patients understand what the difference is between alternative medicine, integrative medicine. And I'll share that, quite often patients are actually relieved to find out that they don't have to take 100 supplements a day to be successful as far as supporting their health during their cancer treatment. Sometimes there's an idea that in order to create that bond with the patient that you need to support their use of integrative, so that you need to support their use of herbs and supplements. Not necessarily. Sometimes you create the bond by, explaining to them, why or why not, what are the safety concerns? Why is it that my oncologist was not recommending this supplement? If you give them the why, they'll usually understand it and make the best decision for their health. So what are integrative approaches? So I spoke about the herb supplement part of the conversation with our patients, and as far as the interdisciplinary team, mentioned that we have a dietitian in our integrative medicine program at MD Anderson. We also have a physical therapist who does exercise counseling. The important thing is that any diet recommendations that we make are based on guidelines. Any exercise recommendations that we make are based on guidelines. We specifically look to the American Institute for Cancer Research regarding plant-based whole food guidelines, and then the American College of Sports Medicine regarding exercise oncology prescriptions. American Institute for Cancer Research, here I show the recommendations with the idea that at least 2/3 of what patients should be eating come from plants and 1/3 or less from lean animal protein. And then we've also developed patient education documents that speak to the providing more information about the existing guidelines. When it comes to exercise, the American College of Sports Medicine has this Moving Through Cancer Exercise is Medicine framework, with the idea that there are specific exercise prescriptions that can be given to patients based on symptoms that they're experiencing in the yellow rectangle on the left side. So as it states, strong evidence to support benefits of exercise for cancer-related fatigue. In this case, the dose 3 times per week for 30 minutes each time. And then our patient that I mentioned earlier, the first case of the young woman with breast cancer history, she had mentioned about anxiety regarding fear of recurrence, anxiety leading to stress eating. And so, for example, we have health psychologists that are part of our team that address that psycho-emotional side. There was in the NCCN guidelines that I shared earlier as well, it mentioned about cognitive behavioral therapy and psychoeducational counseling as important interventions to help with cancer-related fatigue. So again, that would also be an intervention that the psychologist can help with. So anxiety, fatigue, stress eating, and then also can support lifestyle behavior change. And so if someone is having a struggle with motivation to exercise or motivation to eat well, working with a health psychologist can help with the motivation and accountability. Other integrative interventions. So for example, oncology massage. We have oncology massage as a treatment that is made not because it's nice, but because there's a lot of evidence supporting its benefit across a number of symptoms. I highlight here anxiety, stress, pain, constipation, neuropathy, cancer-related fatigue. I mentioned about there being a Category 1 recommendation as far as the NCCN, the cancer guidelines. And oncology massage has specific levels of pressure and depth. And so I share here the Walton scale. So you have a pressure level of depth from 1 to 5. 5 is deep pressure. Oncology massage only does level 1 to level 3. We don't want to do any deep tissue massage that can cause internal bruising or additional pain or injury. So oncology massage is really adapting massage to this to benefit the patients and not cause injury. And I mentioned before about us in the clinic on our outpatient center learning from the patient-reported outcome data. Here's an example of the kind of data that we collected pre-post massage treatments. If you look at the left-hand column where it says patients, there are significant improvements in pain, fatigue, anxiety, and overall well-being in connection to a single massage treatment. I'll share that it was this publication that was used as one of the publications supporting the NCCN practice guidelines that I mentioned earlier. Oncology acupuncture. I also mentioned earlier in connection to our patient about acupuncture to help with hot flash symptoms. We know it can help with pain, joint pain, for example, nausea, dry mouth, fatigue, neuropathy, insomnia. And oncology acupuncture is specifically acupuncture where we focus on the use of needling. We don't use herbal medicines with the idea that we want to focus on using the needling as a safe intervention to help treat patient symptoms. Our oncology acupuncturists have specific experience and training in how to adapt the acupuncture technique to make sure that it's safe. For example, if someone is on a blood thinner, they will do more shallow needling, and that will allow us to treat even those patients who are on blood thinners or who have low platelets. Music therapy is a psychosocial intervention, can help with stress and anxiety, quality of life, improving social connections. We have a music therapist on our team. Mind-body approaches, I mentioned about multiple benefits of yoga practice, and so trying to really make yoga available to patients across a number of areas has been one of our efforts. And not everyone has access to a yoga therapist in their community, and so we have developed both virtual programs. We have one-on-one consultations available in our clinical center. We also have on-demand classes, so pre-recorded yoga and meditation recordings that patients can access at any time. So coming back to our earlier patient, so she was 43 years old, obese, was inactive, struggling with fatigue, stress and anxiety, and hot flashes in connection to her tamoxifen. And so I wanted to now come back to that 5 circles framework and outline like what would that plan look like then now based on all that we've learned so far. So the prescription for her would be, for example, with diet, reviewing the American Institute for Cancer Research nutrition recommendations that I mentioned, I would suggest that she meet with our dietitian to help address her concerns about nutrition, eating healthier, helping her to also explore opportunities to lose weight. I mean, she's obese with a high body mass index. There's a benefit to her losing weight as far as reducing her risk of cancer recurrence. She had mentioned concerns about having a low vitamin D, so that would be something that we could definitely check if her primary team, her primary oncology team, her primary care doctor hasn't checked. We can address the vitamin D checking and then supplementation, especially thinking about her bone health. Regarding exercise, she mentioned not really knowing what exercise she can do, she should do based on her oncologist recommendation. And so we can definitely get her connected with our physical therapist for exercise counseling so that she can develop that exercise plan according to the American College of Sports Medicine recommendations. Survivorship, that recommendation would be at least 150 minutes of moderate intensity aerobic exercise per week and 3 days per week of resistance exercise. And the physical therapist can help with that. What that would look like what would that resistance exercise plan look like for her? For anxiety, we can talk to her about potential benefits of yoga, meditation, massage. She mentioned having an interest in yoga, so I could definitely direct her to some of our yoga videos. And if she would be interested, I could also talk to her about meeting one-on-one with our yoga therapist. And then for her fear of recurrence and also goal to lead a healthier lifestyle, could also think about connecting her with our health psychologist. And for hot flashes, as well as her fatigue, there could be benefits of her having acupuncture. Hopefully, if she has less hot flashes, and if the hot flashes are interfering with her sleep, for example, she might have less fatigue in connection to poor sleep from her hot flashes, and then have more motivation, energy to do exercise and make better food choices. And then I'll share. This is the second case, and after the second case, I'll open for conversation. We can definitely come back to talk about these two patients or other questions that you have. So here I share an example of a patient with metastatic breast cancer. She's 63 years old, overweight, has hormone-sensitive breast cancer, has spinal involvement. Her current therapies are letrozole and palbociclib. She does have comorbid health conditions like hypertension, high cholesterol, osteopenia. She's recently retired, lives alone. On that ESAS, so I mentioned about doing the ESAS, the Event and Symptom Assessment Scale, before the assessment that we do in connection to the consultation. So she endorsed a 5 for anxiety and 3 for sleep. Again, 10 being the worst possible. And then she shared that her goals are that she sees cancer as an opportunity for her self-care. She described self-care as a new job. She says that what she knows about herself is that she does better with a plan. She says that she's been having difficulty falling asleep. She thinks that it's stress that's not letting her sleep well. She says she's already tried to exercise more by walking and trying to eat better. Some of the things that she's already tried, for example, are eating less fried foods and eating more plant-based foods. But then at times she says that she feels overwhelmed between her health goals and her ongoing cancer care, especially since she has metastatic disease. So health areas to consider: anxiety, insomnia, helping her to prioritize self-care, goals to eat better, so nutrition concerns, and then questions about exercise as well. If we think about that same framework that we did for our first patient, nutrition, thinking about a nutrition plan for her. I mean, she's already made some changes, but help her kind of take that nutrition change that she's already made to the next steps and have her, follow those guidelines that I mentioned, 2/3 plant-based from the American Institute for Cancer Research. And then she also would likely benefit from meeting with our dietitian. Regarding anxiety, she could definitely be one to benefit from meeting with a health psychology, especially if she's attributing her insomnia to stress. And if she's having challenges with motivation and goal setting, that's a perfect place where health psychologists can work with patients. And then she can also potentially benefit from yoga therapy, especially if she's done yoga before and wants to continue that as a mind-body practice. And then also in terms of helping with exercise and symptoms of fatigue, there could be benefits to massage and yoga, but more specifically based on her interests, exercise counseling with our physical therapist to help her adapt her exercise safely, especially thinking about her fatigue, but also the fact that she has metastatic disease and want to prevent injury and maximize benefit, thinking about energy conservation techniques with her symptoms of fatigue. So this would be one patient where there are a lot of different things that could be done, but she was already saying that she was feeling overwhelmed by balancing her health, self-care goals and her cancer care. So I want to help her find out what's realistic without overwhelming her, because she's already done a lot, and we want to support her, not again, not overwhelm her. So thinking about integrative medicine, there's sometimes this idea that integrative medicine is only appropriate at certain times, especially there's an idea sometimes that if an individual has advanced cancer, that it might be too late to work, for example, on lifestyle goals. That patient that I just described with metastatic breast cancer, she's got metastatic breast cancer, she has progressive metastatic breast cancer, and yet she's super motivated to engage in self-care. She wants to eat healthier, wants to exercise more. So it really just depends on the patient and where they are in their cancer journey, and helping uh, understanding where that patient is at and providing them the right kind of support wherever they are in their cancer journey. Thank you very much.
So thank you very much for your presentation, Dr. Lopez. So as a patient, I can also say that how it is important for patients to have a personalized approach and to have all the resources to cope with the treatment and to have some recommendation on complementary care who can prevent side effects and not going to a non-proven alternative care. So it's really important to have this coordination with oncologists. So the first question we have is, what do you think about oncology aesthetics? Is there a reason why oncology aesthetics is not covered in the same way as massage?
Okay, well, thank you for the question. Can you hear me okay?
Yes.
Yes, okay. Well, and so I guess I'd like to maybe clarify what specifically is being meant by the oncology aesthetics. Because when I think about aesthetics, I think about self-care as far as perhaps maybe awareness of skin health, hair health.
Yeah.
Is that what's being
I guess
recommended?
so. Yes. Yes.
Mhm. Yeah, no. So the aesthetic part is definitely important, and that can be a part of the conversation that we have with our patients. And we don't have someone that directly addresses aesthetics. But for example, if there are patients that have concerns about body image, that can be body image concerns from hair loss, or if someone has a cancer that leads to some disfigurement of any part of the body, whether it's the face, torso, if there's an amputation involved. There are, definitely psychological supports that are available for patients. Now, when it comes to integrative medicine, for example, our mental health providers are more focused on the stress, the anxiety, the lifestyle behavior change, helping with goal setting. But in the context of the big picture of the cancer center, there are health professionals. For example, there's an occupational therapist at our institution that specifically works with patients on body image concerns. There's also, a work that's done by other mental health professionals at our institution that focuses on those body image concerns.
Um, I have also one question for you, Dr. Lopez. Um, do you have any challenge to have two hats? So being an oncologist and also providing some integrative care, complementary care?
Yes, so one of the important things is that, so yes, my background, so I'm a medical oncologist, and then, also do integrative medicine. And the challenge is that, when I am seeing patients in our clinic for integrative oncology, I make clear to them that in that role, I am not functioning as their medical oncologist. I'm not there to make decisions about their cancer treatment. I'm certainly, happy to answer any questions that they might have if there's some things that they're not sure about, and that I can always, send some of those concerns back to the oncology team if I'm not able to answer to their satisfaction. But that, my role in seeing them in that integrative consultation is not to focus on the cancer treatment, but to focus on their supporting their health during that cancer journey, with an awareness of what are the side effects, what are some of the common challenges that patients that are getting that medication or who have had that treatment might be struggling with, even helping them to anticipate some of the symptoms that they can be developing in connection to the cancer treatment. For example, if there's surgery, coming up, we can talk about the importance of there not being sedentary, importance of exercising, not doing too much, but at least getting out and making an effort to walk every day, and how that can help improve their surgical treatment outcomes. So really having that conversation with patients to help them understand that there's an oncology team, and then there's the integrative medicine team, that we're working together. I'll share this. Sometimes I've had patients, say, I just met with my oncology team, and they made all these recommendations for, cancer treatments, and, they just want to give me radiation and chemotherapy. They just want to poison me with these cancer therapies. But I know you're the integrative medicine doctor, and you're going to tell me about treatments that I can get that aren't going to poison me, right? So just as an example, and that happens quite often. The idea isn't to say, oh no, your oncology team, they're terrible, they're going to poison you. No, the idea is, oh, so it's good that you share that with me. Have you shared that concern with your oncology team? Have you told them that you're concerned that these are poisons? Because they probably want to help you, kind of understand better about how these work, and how they're not poisons, but they're actually, treatments for your cancer. They're actually there to help you. So kind of sometimes helping them to navigate that concern that might lead them to then pursue an alternative medicine rather than come back to their conventional oncology team for care.
Mm-hmm.
So sometimes it's not about anything having to do with recommending acupuncture or massage or yoga. It's just about helping them stay within the
With the treatment.
evidence-based medical care.
Yeah. So we have a question from Anne Smith. So she's part of the new Bell SIO, so the SIO from Belgium. And she asks, what criteria do you use to select the right therapist?
Yeah, good question. So the right therapists are not easy to find, right? And so I would say it's wonderful that the guidelines include a number of treatments that are helpful, but as far as finding the right therapist to do massage, to do yoga, to do acupuncture, that's the challenge. And so at least in the context of our center, it's a very thoughtful process of interviewing individuals and then having them, become part of our team, and introducing them to all the philosophy of integrative medicine. So there's a very strong onboarding process for us in terms of when we're hiring people to become part of our team. The challenge, though, is that we can't possibly meet the needs of all of our patients with our team, and so then it's also important to, find community providers that are willing to function within the limits of what integrative medicine prescribes, right? So if there's an acupuncturist in the community, for example, that's going to be treating our patients, we want to make clear that we're not going to be that the goal would be to treat them with needling only, and not to use herbal medicines, right? So to have the community providers align in terms of what is integrative medicine, and not to provide treatment that's kind of alternative or outside of what would be the care that's evidence-based and safe. So yeah, so no, definitely a challenge, and there's a lot of work that's going on. For example, the Society for Integrative Oncology is trying to work on, what are those fundamental aspects of practice that are needed for each one of these different kinds of specialty therapies to help find the right kind of individual to treat the oncology patient.
And they are specifically trained for oncology, so to treat patients, so cancer patients. So do
So,
you have
so,
specific training for them?
so in the United States, there's oncology massage as a recognized, area of practice, and that there are requirements. There's trainings that are available that individuals can take to be recognized as an oncology massage therapist. Oncology acupuncture, for example, is now being recognized. So acupuncturists are getting additional training and expertise in how to work with cancer patients. Similar efforts are ongoing with yoga. So that you want not just a yoga teacher, but you want a yoga therapist with oncology specific knowledge to be working with patients. So there's this kind of specialization even within these different integrative therapies that there's a strong move towards having more of that kind of training.
Okay. So next question is who is in charge of the care coordination between conventional and complementary therapies? What is the role of oncology nurses in these integrative care plans?
Yep. So the care coordination, once a patient in our model, is referred to integrative medicine, the care coordination is led by the physicians together with our advanced practice providers. And so advanced practice providers in the United States, at least, include physician assistants and also advanced care nurse practitioners. So the the question about the role of oncology nurses, and so we do have an advanced practice provider, which is a nurse practitioner that helps with care coordination. Our physician assistant and nurse practitioner both mostly help with the care coordination on our inpatient service. So we have an outpatient clinic and we also have an inpatient service. But we also, as a team, meet weekly, including our nurses, including our therapists, including our physicians, to discuss our patient cases and then work on that care coordination. So it all happens within our team. We're not functioning independently of each other, but we all work together to coordinate that care.
Okay. I think that, yes. What do you think about physiotherapy in water, in pool? Is there medical evidences of superiority comparing to classical physiotherapy?
So I wouldn't say, well, I will say this. So physiotherapy is definitely not my area of expertise, but I will say that there are different interventions that are part of all of the tools and techniques that are available to the physiotherapist. And definitely the water pool can be appropriate for certain patients, especially those who are having challenges with balance. And so I would say that it wouldn't be a substitute for classic physiotherapy, but that it can be, a very useful tool for certain patients, depending on what those goals are. We have our physiotherapist, our physical therapist, who helps primarily with exercise counseling. But if we have patients who have greater needs in terms of their physical recovery, we do have classical conventional physiotherapy where we do refer patients to. So our physical therapist is mostly focused on the exercise prescription. More limited visits, it might be 1, 2, or 3 encounters versus the classical physical therapist might meet with a patient 8, 10, 12, more times and more intensely, more acutely, depending on what the goals are.
We have a question from Greece. So I'm based in Europe, so in Greece, and I'm wondering about the reimbursements issue. Is integrative medicine recognized and reimbursed?
So this is a great question, and definitely I would say it is country specific, in that there might be some therapies that are reimbursed and others that aren't. For us in our practice, the physician consultation is reimbursed. The physical therapist consultation evaluation for exercise is reimbursed. For most patients, the health psychology, so working with the psychologist, is reimbursed. As far as practices like music therapy, yoga therapy, massage therapy, acupuncture, those are less often reimbursed, although some insurances do reimburse for acupuncture and massage. Nutrition services at our hospital, at least, are considered a patient service, and so there's no charge to patients for having that nutrition consultation. So really, it can depend on the country, but also the individual center where those treatments are being offered. In quite a few centers, philanthropy is an important part of what supports the access to integrative therapies. And in those cases, it could be that all of the above therapies, massage, acupuncture, yoga might be available at no cost to patients. So reimbursement is a challenge because reimbursement does can be a limiting factor in terms of having access to these integrative therapies. Even if the guidelines show that it can be beneficial, patients may not have access to them due to cost or even distance, right? So if one of these therapists is too far away, if the closest acupuncturist is 200 miles, or let's say 400 kilometers away or so, it might be not a reasonable expectation for that patient to have an acupuncture treatment once or twice a week for 6 to 8 weeks.
Do you have a specific yoga for integrative oncology?
Yeah, so there are many different yoga
Yeah.
practices, and we in our center we use what is referred to as Vyasa. It's a Vyasa yoga, and that's the uh, type of yoga that we've studied at MD Anderson in our own research. Doesn't mean that that's the only yoga practice out there that can be beneficial to patients, but I would say that definitely the idea is that the yoga is not meant to be in cancer care a substitute for exercise. It's meant to be a mind-body practice, and so breath first, and then
Okay.
movement as far as helping with different symptom goals. So not meant to be a boot camp or exercise program,
Okay. It's more for yes, anxiety,
more for the mind-body
the
aspects.
mind body aspect. So the webinar is coming to an end. So thank you very much, Dr. Lopez, for your presentation and for replying to the questions. So thank you very much for your participation. It was really interesting. So we hope this session has provided to you a better understanding of integrative oncology and its positive impacts on health and on the patient outcome. So stay tuned for the next webinar. It is planned in June. And yes, see you soon and thank you very much. Thank you and goodbye.
Thank you.
Bye.